We're at the Global Health Conference here in Loma Linda, California, 2018, and I have with me Dr. Greg Saunders, who's a missionary for the Adventist Church to a hospital in Lilongwe. Good afternoon.
Good afternoon.
Thanks for being here.
Pleasure.
So you were a missionary before?
I grew up in the mission field. I was born in the mission field.
Fantastic. Where were you born?
In Karachi, Pakistan.
And what were your folks doing?
My father was a medical missionary, also a surgeon.
And you got it handed down to you.
Yeah. So when I was 2, we moved to Ethiopia and lived there for 10 years, and then moved back to the States. Well, it was not like moving back for me. It was new.
The first time.
Yeah.
Okay. And you did your training here.
Yeah.
And became a surgeon yourself.
Yep.
And where did you go the first time around?
Well, I was after my Air Force commitment for my scholarship, but I went to Nigeria, in the hospital at Ile-Ife in southwestern Nigeria for 10 years.
Okay.
Where we crossed paths, I believe.
We did. I was there as a medical student doing a 4th-year rotation. And then you finished your 10 years, you had kids headed to college and whatnot, and moved back to the U.S.
Yeah, when our oldest boy started college and Sarah was about to start college, then we moved to the States and got them all through and launched.
All right, and now that they're launched, you decided do it again.
Africa, yeah.
All right, tell us about your current mission work.
Yeah, it's a little different this time because we're in a city where we're serving more of the paying clientele rather than the people of poverty, and trying to develop a facility that's more sustainable on its own, that doesn't rely on outside funding to keep it alive. So there was no surgical facilities when I got there. So I was doing endoscopy and minor surgery procedures in one of the rooms of the health center. And sometimes we ended up doing major procedures there because we couldn't get an operating room somewhere else.
That's right. I mean, if you have an emergency and you've got nowhere to take it, so I understand you did even some major surgery in there.
Yeah, at least 3 or 4 cases that were pretty major, with just some ketamine anesthesia. So.
All right. Tell me one example of what, before you got your operating room built, what did you have to do?
Yeah, we had a kid come in with a perforated duodenal ulcer who had peritonitis, and so we did a laparotomy with the repair of his duodenal ulcer. And also had a young physician. This was my first case in Africa of a perforated diverticulitis.
Oh.
I actually thought he had a perforated duodenal ulcer because I didn't expect a man in his 30s who came in with a rigid abdomen, peritonitis, explored him upper, and then didn't find anything. I put my hand down in the pelvis. There was this sigmoid mass that had to be resected, and colostomy and all that. So we did all that with just ketamine anesthesia.
In your endoscopy room with no...
In our endoscopy room. So, and he did well.
And he did well. So that's and thank the Lord for that sort of mission work that you're doing. And over the last 2 years, you've then raised the money and constructed a brand new operating room.
Yeah, we have actually 2 operating rooms and the associated recovery room, staff lounge, sluice room where we wash the instruments, and the sterilizing room, all that. So it's actually quite a nice facility. Thanks to my mom who helped raise the funds.
Absolutely. And some support back home. I mean, I'm sure, Adventist Health International, other people have really helped with this sort of thing.
It was a nice work of the whole team internationally. So.
Yeah, but so we're grateful for any donors that have put in for that project.
Absolutely.
And so at this point, you're doing full major procedures there?
Yeah, and we're set up to do laparoscopic surgery there. So I'm doing, some laparoscopic gallbladders, and now I can repair those perforated ulcers laparoscopically in a nice operating room.
Great,
nice.
Great. So the work that you're doing now, I presume you feel more fulfilled sort of in the mission field perhaps than you did in other places.
You mean than in the States?
Mm-hmm.
Yeah, obviously the need is a great deal more than the United States, and if we weren't there, it's not like people can go down the road and get the same services somewhere else. But I mean, the two aspects of this, I think that interest me most are being able to develop facilities that long-term can be sustainable and retain the national physicians so that they have somewhere that they can work that's reputable and can support them. And the other part is to train those people. I know we don't have a training facility in Lilongwe, but I've been helping out some with the surgery training program in Malamulo, which is about 5 hours drive to the south of us. And hopefully, as we get busier, we can get some of the residents to rotate up with us and get more of an urban experience, which is a different cluster of diseases, the affluent urban people rather than the rural poor, which they have, and there's a tremendous amount of pathology there as well. But I think it will round out the training for the residents better if they can have both of those experiences.
Yeah. So we do face a challenge in general trying to provide healthcare to poor people that can't pay for those resources. So trying to bring in resources from other countries to the poorest countries that don't have anything to buy and don't have resources to even make medical medications, medical equipment. And at the same time creating facilities that provide high enough quality of care to attract all the businessmen and upper class that are working there.
Yeah.
And I think you've got some programs there at your hospital that try to tie that in. You provide, excellent quality care from the surgical perspective, and you actually employ several national Malawian physicians to take care of some of the other.
Yeah, in the primary care level, we have Malawian physicians that are there, and the institution supports them well. So.
Tell me a story about maybe someone who's come in and had care from you, and also one of the Malawian physicians, and even your dietitian.
Well, I end up referring a lot of patients to my wife, who's the dietitian, because we're seeing a lot more of the diseases of affluence, the obesity with the type 2 diabetes and the hypertension. So it's good to have my wife there to do medical nutrition therapy for them, and we also together run CHIP programs to help people who are motivated enough to go through a full lifestyle change.
Yeah. And so CHIP programs, that takes a while. For the audience, tell us what is a CHIP program and how many you've done there?
Well, CHIP, which stands for the Complete Health Improvement Program, we've done 3 of them so far, and we run over 5 weeks, 18 sessions. We're running them in our home. The last 2 we have, where we max out at about 26 people, and we serve a meal. And then we have the video education component, which is put out by the CHIP organization. And so we've seen some good results with that. And people are now lining up saying, when are you going to do the next one? So we try and do it twice a year.
Twice a year for CHIP. So we've got diet and lifestyle, and also the surgery component of it, and then the Malawian physicians providing for you the sort of the medical care. So as you ramp up next year, what do you expect your surgery center will do? Do you have an estimate of how many cases you think your surgery center can do?
It's hard to predict on that, but the 10 days before I came to the States this time, we actually were quite busy, and I think I did at least 6 or 7 major operations, besides a dozen or so minor operations, including endoscopies during that period of time, 2 laparoscopic cases. So, it'll keep me busy, and maybe I'll need help with time. So if there's a surgeon out there who has a hankering to go to Africa, maybe we need to talk. But also the critical care services that we'd like to develop, because if I'm going to be doing bigger cases, then I need that backup, especially with people who have a lot of comorbidities with diabetes, hypertension, and things, so heart disease. And we'll need a cardiologist to come back and help us more, maybe full time.
The country could use 3 or 4.
Yeah.
So, you're ramping up your services. You're one doctor. You're on call 24/7. You're going to need backup, and it's something that's not easy to find other surgeons that are trained in that country. Tell the viewers, the few things that you really need that they can do from here. What would it be?
Well, obviously we need your prayers. We need financial support as well, but we will need people too, until we can have well-trained Malawian professionals. We may need surgeons, critical care Probably our next full-time person we'd like to get would be an internist who will do critical care. OBGYN, we have a part-time one right now, but we're working on trying to get a full-time OBGYN, preferably a female. We do work with a lot of Muslim patients in the city, and we've established some good relationships there. In fact, a relative of a patient that came in as a GI bleeder has promised to get me donors for blood at the mosque that he prays at if ever we need blood again, so that's nice. But the personnel that we need full-time will be the core specialties like internal medicine, surgery, OBGYN, and then pediatrics as well as we grow. And hopefully as time goes on, we'll offer more specialty surgery things as well. So if there are people interested in that, we need to talk.
Thank you. So this is Dr. Greg Saunders from Lilongwe Adventist Hospital in Malawi. And if you have anything to offer for him, please try to get in contact with him and volunteer your services.